So you had your weight loss surgery. It's very successful. But guess what? Now you have this excess skin, right? Be honest, some patients tell me that they still feel like they are overweight because they have this excess skin. Well, there's a lot of things that you can do about it, and that's what I'm going to touch on in a few minutes. My name is Dr. Beltre from Beltre Bariatrics. Thank you for tuning into our YouTube channel, and I hope this information it's helpful to anyone there that's had weight loss surgery. So why do we get this loose skin after losing weight? Well, there are these things called collagen, right? Collagen fibers that live on the skin. You think of collagen fibers like rubber bands. When you stretch a rubber band, right, which happens when collagen fibers get stretched when you gain weight or during pregnancy, when you stretch this rubber band and it stays stretched for a long time, if the rubber band is healthy, it can bounce back. If the collagen fiber is not healthy, it will stay stretched. And therefore, you can lose a lot of weight and still have this stretched skin. Essentially, that is the basis for the stretched skin. It has to do with how healthy the collagen fibers are. And again, you can think of the collagen fiber as these rubber bands. Also, there are a lot of things that affect how much excess skin you're going to have after weight loss. And some things you have control over, and some things, unfortunately, you have no control over. Number one, sex. Male patients tend to do a little bit better than female patients in terms of excess skin. Guys tend to have less noticeable excess skin compared to a female patient. And if you have two patients, one male, one is female, they both lost the exact amount of weight, let's say 60, 80, 100 pounds, the male patient is going to show less excess skin than the female patient. Number two, genetics. There are people, whether male or female, with good skin, right? I know female patients that go through multiple pregnancies, and after multiple pregnancy, their skin bounces back again to looking to like they were never pregnant. And there are people that were blessed like that. Genetics plays a big role. Another factor which you cannot control is age. And that makes sense, right? When you're young, your collagen fibers are young, healthy, bouncy. You lose a lot of weight, you can get most of your skin to bounce back. When you're older, the collagen fibers are not as healthy. And of course, it means that you have been overweight longer. So therefore, the skin has been stretched longer. So therefore, you tend to see more excess skin with individuals that are younger, and that makes all the sense in the world, of course. And then one very, very important factor, which I think is one of the most important factors, which dictates how much excess skin you're going to have, and that's the amount of weight loss. The amount of weight loss is very important. In my practice, what I observe is the following. When individuals need to lose 100 pounds or less, 60, 70, 80, 90 pounds up to 100, excess skin is not as bad. It's not as noticeable. When you need to lose, or you lose more than 100 pounds, 120, 130, 150, 200. I have individuals that lose as much as 200, 250 pounds in a year with a weight loss procedure. You're going to have excess skin. I mean, that is just very hard to avoid. Excess skin is going to be there based on how much weight you've lost. So from all the factors that I have mentioned, probably the amount of weight loss is one of the most important factors that dictate how much excess skin you're going to have. Then the question comes, okay, that's great. Then what do you do about it, right? Well, there are the things that you can do about it to help you at least decrease the amount of excess skin that you are going to have. Number one, nutrition. You have to stay well hydrated. Our skin is an organ just like any other organ. It needs to be treated, and there's things that we can do that can make it healthier. Stay well hydrated. Exercise. Yes, you cannot exercise your skin, but you exercise the muscles under the skin, right? And if your muscles look healthy, if the muscles are healthy, that can show through this skin. Taking your multivitamins, very, very important. Regardless of the weight loss procedure that you have, whether it's gastric sleeve, gastric bypass, duodenal switch, you need to be on your multivitamins because your skin, just like any other organ, needs vitamins and so on, hydration to stay healthy. Protein intake, very important for your skin, right? Depending on your size, okay, you need a certain amount of protein, whether it's anywhere between 60 to 80 to 90 grams of protein daily, depending on the individuals, to stay healthy. And then there's other things that you can do that has nothing to do with nutrition. Nutrition is very important. What other things you can do? Wearing tight garments. So my patients, they have some excess skin, but it's not as bad, and they wear tight garments and they look normal. You don't notice as much of the excess skin. For individuals that feel they need to have something done, then there are surgical procedures that you can do to treat the excess skin. Now we're talking plastic surgery. And for those that believe that removing the excess skin through surgery will help them, there are different procedures that are done. I find in my practice that most individuals, most of my patients actually go for their arms. Arms are more noticeable, especially here in Florida, right? We wear short sleeves and so on most of the time. And you can see the excess skin in the arms, and they become aware of that. And it can cause some stress in individual because of how it looks. And a lot of them end up getting their arms done first. I find that in my practice, most individuals get their arms and legs done first on the excess skin. Then, of course, come the abdominoplasty or tummy tucks or mommy makeovers, where they remove the excess skin from their abdomen area and breast in female patients. Those are the ones that you see more often in that order. Of course, I find that female patients tend to seek more excess skin removal than my male patients who perform these procedures, plastic surgeons, and there are plastic surgeons that specialize in actually excess skin removal after weight loss surgery, and those are the individuals that I tend to send my patient to. If you are thinking of having excess skin removal, just remember that most plastic surgeons want you to wait about a year or so before you undergo your weight loss procedure. Some even want to make sure there's been 6 months of steady weight where you're not losing weight. In other words, you're completely done with your weight loss before they go ahead and remove the excess skin. Just something to keep in mind. Thank you for listening. Again, I'm Dr. Beltri from Beltri Bariatrics. Thank you for tuning in to our YouTube channel. I hope this was helpful. I know these are questions that are asked by my patients all the time. Thank you.